gotta get in there and you gotta show the techniques, okay? This is just like doing it with a patient. Okay. Alright, so quadruped position is the first one that allows full weight bearing through the hands and the knees. So to get into this position, you're going to make sure your shoulders are in 90 degrees of flexion. You want your elbows in full extension. You want to make sure your hands are directly under your shoulders, and they should be extended as well. Your hips should be in 90 degrees flexion. I'll turn on this side. 90 degrees flexion. Your knees need to be directly under the hips and also flexed. Your feet should be relaxed in plantar flexion. You want to make sure that your trunk is flat, your back is flat, and then you want your head in neutral. So this position is really important to facilitate like crawling and stuff, getting those first little bits of movement going for ambulation.
So with this, the base of support, hands, knees, toes, and sometimes a little bit of the like the front of your leg right here. This is 4 to 6 points of contact. Weight bearing takes place through multiple joints. The center of gravity is still pretty low, but raised compared to the previous positions. Some contraindications and precautions. Lower extremity flexor spasticity, we're looking out for the ATNR and the STNR. Upper extremity, hand and wrist pain, and then shoulder surgery or spinal cord injury, and then non-weight bearing status because we are bearing weight through our upper and lower extremities at this point. If there's any pain in the position, and then unable to hold the head up because we have to be able to maintain the head in neutral.
Okay, so some of the exercises that can be used to produce contractions or stabilizations. So one of the first ones is cat-cow. So this one's pretty common. So you're gonna round the back towards the ceiling. You're gonna hold it for like 5 to 10 seconds, and then you're gonna round the back towards the floor. And you want to make sure that your head is going in the opposite direction of that. This works your trunk flexors and extensors and isometric and eccentric flexors. So then there's a bunch of different alternating things. You can do alternate arm. So you raise one arm off the mat, you hold for 5 seconds, you lower it back, and you're on the contralateral side. You do the same thing for your legs. So you hold it for 5 seconds, and then you let it back down, you do the contralateral. And then bird dog is a common one, so you do opposite arm and leg, you hold. And this one's really good for stability and core strength. And then you put it down, and then you do the opposite. And then a new one that I learned is that you can do bird dog, but with elbow knee touches. So you do a regular bird dog, and then you go in and touch your elbow and knee. That one is really good for testing stability and everything. We also do thoracic rotation. So you're gonna flex the knees and hips until seated on the ankles. And then you're gonna lower one upper extremity on the elbow, raise the other one up behind your head, and then you're going to rotate it all out, and then you're going to rotate everything inwards. This is a really good one. You get that stretch in. Then you do that on the opposite side as well. And then thread the needle. So you're going to do similar to that. You're going to take it out, and then you're going to bring that trunk rotation up and in.
PNF action.
Mm-hmm. Okay. So,
So for facilitation and inhibition techniques, just focusing on the upper extremity, you can ice the biceps. You can do Russian E-stem on biceps to fatigue the muscle, massage, slow stretch, and tapping of the triceps. And then for the lower extremity, basically the same thing, icing on the hamstrings, Russian E-stem to fatigue the muscle, and then massaging the hamstrings, slow stretch, and then tapping of the quadriceps. So a lot of what this is good for, like we mentioned earlier, crawling, like ambulation of the patient if they're unable to walk, like Tracy demonstrated, if they have a spinal cord injury but they're able to get in quadruped, it's a little bit better than dragging yourself across the floor. just safety after if someone does fall and they have to crawl to the surface to get back up. And then just in daily life, if someone drops something or they have to look under something, and then like cleaning the floors, independent ADLs, and then with children, just playing and strengthening. Kids are always getting down on the ground and doing things like that. So for mobility, talking about how to like actually get into this position, there's two different ways. We'll start with from prone on elbows. So what you're going to do is patient, you've already gotten to where the patient's stable in this position. You're going to instruct them to start walking the elbows backwards, and as their hips are coming up, and you'll stop them whenever they get to about right here, and then one at a time you'll have them go into weight bearing on one arm and then the other and push up, and I'll show you the hand holds. We'll go back down to prone on elbows. So there's a couple of different ways to do it. Mainly you can straddle them, you can hold the hips right here, and so we'll just help them get all the way to this position. And then another option is whenever they start to go to one upper extremity, you can hold their shoulder right here, and then the other for the other side, or have any do that.
So the other position you can start from is side sitting. So you want to make sure that the patient has their knees flexed, and then they're kind of off to the side. You don't want them you want to make sure that pelvis is tilted. You want to make sure that their lower extremities are right under them, like how I am. So from this position, they are going to reach across with their opposite upper extremity to the other side, which is going to facilitate that trunk rotation. And then they're going to follow that with, the trunk's going to flex and everything, and their knees are going to rotate around, and then they're going to be in the position. So when that upper extremity is moving across, that's an example of D2 upper extremity extension. So the PTA should make sure that their hand holds, they need to make sure they're straddling the lower extremities and assisting the hips in rotation as they go up.
So once they're in this position, there's a couple of different ways we can apply resistance. The medial and lateral handhold points. So if the patient is coming towards me, I'll make sure I don't get these backwards real quick. All right, so I want to be on this side of the hip, and then the vertebral border of the scapula. And so you're basically resisting there, and you can do it alternating too, like they can push on the hip, push on the upper extremity, and then whenever they're going away, be on the axillary border. And so it's like, don't let me pull you, and then don't let me push you. And then for anterior and posterior, one of the positions is you can be off to the side, but for this, basically you'll be, whenever going anterior, you'll be holding on the top of the shoulders, or you can hold the pelvis as well. And then whenever they're coming posterior, you're basically just pressing against their pelvis.
Alright, so controlled mobility. So some of the exercises you can do for this are alternating arm and leg lift that we did earlier, which improves balance and strengthens the upper and lower extremities. It also works on that core strength again. Push-ups improve your tricep and abdominal strength. Planks, same for core and abdominal strength. Bridging, like Sean and Liberty were talking about, improve that hip strength and mobility so that you can get around and everything easier. Quadruped with rocking is really good. So you can go anterior, posterior. You can go lateral to lateral. also do circular motion. So that all is really good for hip mobility. And then as far as skilled mobility goes, these activities in Quadruped can be like cleaning floors, gardening, removing weeds, and playing with toys.
Okay. So, what do we need to make sure that we have on?
Gate belt.
Why? Well, because we're coming up with our center of gravity,
Yeah,
and
go
yeah,
face
and you
first.
want to be able to hold on to him. Something else is you can use the ball, right? And so that way it's supporting him, even if he can't weight bear completely here. Now this is the first place that we are weight bearing through the hips. Okay, not the full lower extremities, but the board will ask the first position where we start to weight bear through the hips. And this is it, okay? But this also here with the ball, we can do a lot of our stability back and forth, side to side, diagonals here. And you can also be working on your scapula and pelvis as well. And so you can resist, so resisting this way, and then resisting him coming this way. And then you can, you're gonna start to rock back into Jaren's position, or who's got kneeling? Kayla's position. And so that gets him ready to do that, okay? And then he could also crawl using the ball for support here, and then you could be here behind him, like with the gate belt, and then you're working, he's going forward with his hands, and you're working the leg. Did you do that on purpose?
No, it's actually stuck.
I was like, I can't move his leg. So, listen, these are things you are going to have to get in there. Like, you are like, yes, when you're doing neuro, you are right there. Okay? So, like, if he didn't have the ball, and I'm trying to get him to move, I mean, I'm like moving him. Okay? We are, what are we?
I don't
Girl.
know what we are.
Lifelong
learning.
What do we do? Physical therapy, okay? And so I'm using my body to weight shift and to do his mobility. What if you don't do this? He's not gonna make progress.
That's great.
You have to do this. When we work with kids on developmental skills and we work with patients with neuro issues, you've got to get in there with your body. Just like, so right here. Will and I mean, we're, right?
I think we get the point. Leave the man alone.
No, but you understand what I'm saying.
Yes, we get it.
So,
Well, we have
you
counselors
can't
on
not
campus.
do it. You can't go, well, I can't do this with my patient. Yes, that's what we have to do. Or Will's not gonna make progress.
It's not gonna be real.
Yeah, you do. You've got to